Tuesday. They will be conducting that outreach starting with nursing homes, and they will be ramping up. So they're starting with one nursing home a day. They're prioritizing those which have cases, but the idea is to ramp up this effort and to try and prioritize as much as we can. It's just the beginning. We're starting with that one strike team. We're going to expand as resources allow. The goal of this is of course to save lives, but to go on the offense. And the more we're able to do this, the better we'll be able to choke off the virus, stop it in its track, and move forward. This prepares us ultimately for the next phase of this, to take the tests to where they need to go. That's what we're doing. The more tests we have, the better we do that, and so that's why we're still pursuing options for even more tests. We're in communication with the City of Houston on this, and they are developing the details as well. The second announcement today, and it relates to testing, is we're proud to be able to double the number of pop-up testing locations from 2 to 4. So we already have 2 fixed locations in Katy and Baytown. We have 2 mobile locations, and now we're going to have 2 more for a total of 6 sites on top of the strike team that we're going to be sending to these congregate care facilities. So this week, the first 2 mobile locations will spend Monday and Wednesday at Tomball and Southeast Houston, and they will spend Thursday through Saturday in Southwest Houston and Crosby. The 3rd and 4th mobile site, we will announce the locations. The county commissioners, the precinct commissioners, and staff are identifying where they're most needed, and I'm grateful to each of the commissioners for their partnership on this. Look, we're a big county, and we need to make it easier for folks to be able to get tested. One part of it is ensuring that there's not that barrier. We're also working folks who do not have transportation to be able to take the test directly to them, to their homes. So we're doing everything we can to reduce that limitation. In particular, as soon as we're able to contain and begin doing more thorough contact tracing again, it's going to be imperative that we take the test to the people who've come into contact with those who've tested positive. And so this is a key portion of our proactive strategy for the next phase. We'll have a map later this week on Ready Harris that folks will be able to see in which part of town we have the different mobile sites. And of course, when they call, when they do the screening, they'll be directed to the one that's most convenient to them. Let me close by reminding folks that our public health intervention on face coverings began this morning. This weekend I saw so many people wearing coverings, some of them quite beautiful, I might add. And I just want to remind folks that you don't need to leave your house to get a face covering. We don't want people scrambling, where do I get one? You can wear a t-shirt, make one at home out of a t-shirt or cloth. You can use a scarf, you can use a bandana. The idea is simply to cover your nose and mouth. And so no need to rush out and worry about buying something, just whatever you have on hand. I don't expect to hear about fines being issued, and I want to make clear that to the extent fines are not issued, that doesn't mean we didn't succeed. That's never been the measure of success. Every single order we've had, from the stay home, work safe order, to the bars and restaurants, and now masks, there's been a fine attached to it. The first 2, the bars and restaurants and the stay home, work safe order, also carry jail time. But police, as far as I know, haven't issued one citation or arrested a single person in relation to any of these orders. The prioritizing of education is nothing new. I've said it time and time again every time we've issued these orders. And as soon as police have showed up, folks have done the right thing, which is why they haven't needed to do anything more. Our community has stepped up. They've flattened the curve. They continue, and we all continue to do our part. And so to the extent that education continues to work, great. And I really want to caution folks not to measure success in terms of fines issued, because in that case we would have failed already. None have been issued as far as I'm concerned on any of the orders, because folks have done their part. Now that doesn't mean that fines are not a possibility. As I've said, this is not a police state. We prioritize education, but we need to make the order enforceable. For the same reason, seatbelt laws are finable and enforceable, or parking in handicapped spaces is finable and enforceable, is to show that it's not a recommendation, but it's a requirement. This is about protecting life, protecting safety, and we have to send the signal that it is not optional. But that doesn't mean we go out there and find people to arrest or find people to fine. I know this is uncomfortable. I'm having to, pull my mask up here every once in a while. It is day 34 of the Stay Home, Work Safe order. That is 34 days of saving lives. This is not just a throwaway line. It's the reality. Each of you at home, each of you wearing a mask, you are protecting other people. You are saving lives. You have saved lives. You've saved thousands of lives. And so I just want to thank everyone for their patience, for their sacrifice, for all they're doing. And I'll conclude with that. I'm going to repeat my remarks in Spanish, and then we'll hear from Dr. Shaw very briefly, and then allow for some questions. Primero quería recordar y agradecer a la prensa. Empecé mi carrera internacionalmente luchando por la prensa libre, por la libertad de expresión, la transparencia, y es más importante hoy día que en cualquier momento. Sé que siempre hay preguntas difíciles, hay desacuerdos, pero ese es el punto de que haya libertad de expresión. Entonces quiero agradecerle a los periodistas, a los productores, a todos los camarógrafos, todas personas que trabajan por llevarnos la información. Y se agradece todo día, pero especialmente el día de hoy, ya que este fin de semana hemos perdido un gran miembro de nuestro grupo de prensa, Willie Dixon, quien era fantástico trabajador, participaba en estas ruedas de prensa, en varios eventos del condado con quien tuve el privilegio de interactuar, y quería decirle a todos sus colegas en ABC 13, a su familia, su esposa, sus hijas, que lo apreciamos, su profesionalismo, su corazón, nos hará falta, y agradecemos a todos los miembros de la prensa que están trabajando por nosotros, por hacer las preguntas difíciles, por informar a la comunidad. Los apreciamos, les agradecemos su trabajo, y que descanse en paz, Willie Dixon. En cuanto a los casos, hoy día estamos reportando 24 casos más en el condado Harris y una muerte adicional. Eso es fuera de la ciudad de Houston. En total, entre el condado y la ciudad, ya vamos más de 5,700 casos. Son ya casi 25,000 casos en Texas y más de 90 muertes dentro del condado Harris. Siguen subiendo estos números, estaremos muy pendientes, y recuerden, a medida que todos mantengamos esa distancia, vamos a minimizar el contagio, minimizar las muertes y los nuevos casos. Hoy tenemos 2 piezas de información diseñadas a construir capacidad adicional para nuestras comunidades en cuanto a las pruebas. Hemos dicho desde el principio que las pruebas son un componente vital de nuestra estrategia de contener el virus. Van a ser absolutamente necesarias para la siguiente fase de este virus. Y hoy voy a compartir cómo estamos expandiendo radicalmente nuestras capacidades. Primero, sabemos que recibimos la semana pasada muy buenas noticias de FEMA, de la agencia federal, que nos iban a permitir mover los materiales de las pruebas de las sedes fijas, los centros fijos, a otras áreas en la comunidad. Se les agradece mucho su apoyo, y el día de hoy estamos construyendo en eso para una nueva iniciativa. Como he dicho antes, las personas mayores, personas que viven en centros donde se agrega la gente, por ejemplo, en hogares de personas mayores, en hogares para personas sin casa, para víctimas de violencia doméstica. En todas esas áreas es más probable, por lo que la gente vive en contacto cercano, que se contagie y se expanda el virus. Hemos visto que hasta de 1 en cada 4 muertes del COVID-19 de alguna manera tiene que ver con un hogar de ancianos. Eso no es aceptable. Personas mayores y otras personas, individuos viviendo en grupos, no deben estar en una situación tan vulnerable. Y hoy día ya no lo vamos a permitir más. Por eso hoy vamos a anunciar, y estoy anunciando, un equipo de ataque contra el coronavirus. El equipo de ataque incluye epidemiólogos del condado, expertos de salud pública y trabajadores que administran pruebas. Este equipo va a visitar aquellos centros donde vivan muchas personas en grupo, empezando con hogares de ancianos, y estarán administrando pruebas tanto a los trabajadores como a los residentes. También observarán las condiciones, los procesos en estos centros, darán recomendaciones y, si es necesario, van a imponer órdenes de control para que se lleve a cabo procedimientos responsables que protejan a los residentes. Esto empezará mañana. Empezamos con un equipo, el cual visitará un centro de personas mayores al día, y a medida que pase el tiempo y recibamos más pruebas, vamos a crear más equipos y visitar más centros cada día. La meta es no solamente salvar vidas, sino también trabajar de una manera proactiva, en la ofensiva en vez de en defensa, para aislar el virus, particularmente en áreas donde es posible que se expanda aún más y más rápidamente. Entre más rápido podamos hacer esto, más fácil nos va a quedar limitar el contagio de este virus, y esto nos prepara para la siguiente etapa, la siguiente fase contra este enemigo invisible. Estamos trabajando con la ciudad en este esfuerzo. Esto será solamente para el condado Harris, fuera de la ciudad de Houston, pero sé que ellos están trabajando por un esfuerzo similar. El segundo anuncio es que vamos a duplicar el número de centros móviles en el condado Harris. Hasta ahora hemos tenido un centro de pruebas en Baytown, uno en Katy y 2 móviles. Ahora vamos a tener 4 sedes móviles que adicionar. Entonces, esta semana las primeras 2 sedes móviles pasarán lunes a miércoles en Tomball y el sureste de Houston, y de jueves a sábado en el suroeste de Houston y en Crosby. Ahora vamos a agregar una tercera y una cuarta sede móvil, y estaremos anunciando dónde estarán esta semana más adelante. Empezarán el jueves. Somos un condado enorme geográficamente, y parte del límite, del obstáculo para muchas personas que se hagan la prueba es simplemente la dificultad de llegar a donde se administran estas pruebas. Entonces, este es un paso, y seguiremos trabajando por tener más pruebas, poder hacer más sedes móviles y analizar dónde debemos llevar estas sedes para acercarnos a la comunidad. También ahora tenemos la capacidad de ir a casas donde hay personas que fundamentalmente no se pueden mover, los visitaremos y les llevaremos la prueba a casa. Entonces, esto empieza el lunes. Estamos trabajando con los comisionados de cada precinto para decidir dónde en el precinto estarán estas sedes, y seguiremos trabajando por llegar a cada esquina de nuestra comunidad. Lo importante es, especialmente cuando nos movemos nuevamente a contener el virus, tenemos que poder asegurarnos que cada persona que haya tenido contacto con alguien que tenga el virus, que esa persona tenga acceso a pruebas. Finalmente, recordarle a la comunidad que la intervención de salud de coberturas faciales empezó esta mañana. Esta semana vi muchísimas personas por fuera utilizando coberturas faciales, mascarillas hechas en casa, muchas bastante bonitas. Y quiero recordarles a todos, no tienen que salir de casa para comprar ni obtener una cobertura facial. Puede utilizar una camiseta, una camisa, se la puede amarrar, puede construir la mascarilla basada en la camisa, hay instrucciones por internet, puede usar un pañuelo, una bufanda, todo eso funciona. Entonces no hay necesidad de sentirse abrumado, preocupado, ¿dónde compro mascarilla? No es sino taparse la nariz y la boca. No predigo que escuchemos acerca de multas. No, de hecho, espero que las noticias sean que no se emitieron multas el día de hoy para en cuanto a las mascarillas. Eso no significa que no fue un día exitoso. La medida del éxito nunca ha sido cuántas multas se han emitido. Desde todas las órdenes que hemos tenido, la de quédese en casa, la orden de los restaurantes y los bares y ahora la orden de las mascarillas, siempre ha habido una multa. De hecho, las primeras 2 órdenes también incluían tiempo en la cárcel. Hasta donde yo sé, la policía no ha emitido ninguna multa ni ha arrestado a nadie porque no ha habido necesidad. Esto de priorizar la educación no es nada nuevo. Se ha pedido desde la primera orden, se ha dicho, por favor, prioricen la educación. Y la realidad es que cuando la policía ha llegado a situaciones problema, los residentes han obedecido. No ha habido necesidad de emitir multa ni de arrestarlos. Y confío que ese va a seguir siendo el caso. Entonces, obviamente está la multa ahí por si fuera necesario, pero espero que todo continúe como ha sido y que no tengamos que utilizar eso. Eso sí, tenemos que tener la multa porque es importante explicar que esto no es opcional. Es por eso que hay multas para las personas que no utilicen cinturón de seguridad o que estacionan en un estacionamiento para personas con disabilidades. Es importante que haya eso como una señal, que esto es un requerimiento, no es un favor que se le está pidiendo a todos, porque el utilizar mascarillas salva vidas, protege a las personas alrededor nuestras para que no se contamine. Voy a terminar con decir gracias. Sé que esto es incómodo, yo me estoy ajustando aquí mi mascarilla que se me empieza a caer, es incómodo, estar en casa es un sacrificio enorme para todos nosotros. Todos hemos estado haciendo grandes sacrificios y solo quiero decirles a ustedes que su sacrificio vale mucho. Son vidas las que están salvando y eso no lo digo solo porque sí, es porque es la realidad. Miles de vidas humanas que ustedes han salvado al quedarse en casa, al utilizar una mascarilla, al no encontrarse con personas con quien no viven. Entonces, gracias por ese sacrificio, por eso estamos haciendo progreso. Pronto espero poder avanzar poco a poco y solo quiero darles las gracias a todos. Ahora vamos a escuchar del Dr. Shah y después responderemos preguntas. We'll hear from Dr. Shah very briefly, and then both of us will take questions. Dr. Shah.
Thank you, Judge. Thank you for your support of our public health mission. I really want to thank you. I also want to just thank our community. Let me start by saying, Dr. Umair Shah, the Executive Director of Harris County Public Health Authority for Harris County. And let me start by thanking our community. I want to join the judge in really saying thank you to everyone for everything that they have done to really help us fight this virus. And I think there were a couple of things that we've said throughout this entire pandemic, that there were 2 real issues that we were monitoring. One was really related to our healthcare system. The worry for surge in our healthcare system, the worry for an overwhelming number of people that might go into the healthcare system, and obviously that overwhelming surge would mean that we would see what was happening in other parts of the country or the world. And fortunately, we haven't seen that here. And I really want to say that we have been successful as a community, and we really need to give kudos to our community for all of us working together in order to be able to really fight this virus. The other number that we've been watching is the testing number. And so while that first hospitalization number gives us a severity of how sick people are when they are needing to when they get COVID-19 or needing to get care, the second number is the number of testing that's happened in the community. Our department has tested over 15,000 people at our several mobile sites, as well as the 2 FEMA sites that the judge mentioned. But I think the theme today is really testing. And testing remains an important piece of this, because as we test, we start to determine where in our community things are happening, where we can really launch all of the different activities or implement the strategies in order to be able to continue to fight this virus. So as the judge mentioned, that our online tool remains live. It's at readyharris.org, readyharris.org, and we want to make sure people go to that online screening tool to get tested at our Baytown, Katy, as well as our mobile testing sites that the judge mentioned we're now expanding later this week. So it's going to go from 2 sites to 4, plus the Baytown and Katy fixed sites, as well as the phone number, which is 832-927-7575, 832-927-7575. And what we want to say is that the theme is testing. If you have symptoms, especially we want you to go to get tested. But if you do not have symptoms, but you feel that you have been exposed or you want to get tested to make sure that you have not gotten COVID-19, we want to make sure that you go to our online tool or call. Now, the judge also mentioned this launching of the strike force, we call it the multidisciplinary team strike force, and that strike force is made up of epidemiologists, clinicians, social workers, data people, as well as our environmental health folks. We want to make sure that they have the ability to be able to go into various settings, including congregate settings, as the judge mentioned. Why is this important? This is important because we've already seen over 50 cases in nursing homes in our community, and across the country we've had over 10,000 deaths that are related to nursing homes across the country. And it's absolutely critical for us that we do everything we can for those who are most at risk. And certainly seniors, those with underlying medical conditions, rise to the top. And we have over 500 nursing homes and long-term care facilities, et cetera, in our community. We have to do everything we can to continue to protect those who are most at risk. And so that's where the strike team comes in. And also, if you contact the readyharris.org tool or 832-927-7575, if there are individuals who are not able to get to any of our testing sites, we can actually make arrangements for even potentially for homebound people to come to their homes. And so we want to make sure that that's also clear. We do not want any barriers for testing in our community. One last reason why testing is also important. The CDC just this weekend added 6 new symptoms to the list of symptoms for COVID-19. It was before shortness of breath and cough and fever. Now it includes chills, shaking from chills, muscle pain, headache, sore throat, and this loss of smell or taste that we've also seen in reports. So we want to make sure that as you have these additional symptoms, or you have one of those symptoms, or it's not just fever or shortness of breath or cough, that we want you also to be thinking about, I need to get tested. And that's why testing is such a critical piece to this. And the last thing I'll say about testing is that we know that testing constraints continue in our community. We have right now ample coverage and ability for our testing sites to handle testing in our community. Right now, if you want to get tested and you go to our Baytown, Katy sites, the line is almost nil. It's 20, 30-minute wait and you're through. This should not be a barrier that you do not want to get tested. Everyone can get tested. Please get tested. We want to do whatever we can to understand this disease in our community and to protect all of us and all of you. Thank you. Judge.
Thank you so much, Dr. Shaw, and to the entire public health team for building the strike force, all these testing sites. These folks are working literally day and night to try and get the communities the resources it needs. So thank you to you and your team. We'll take some questions now.
Good morning. The first question is for Judge Hidalgo. Why not walk back the fine if both law enforcement officers in the city of Houston and in the county say that they're not going to fine people or issue a fine? Why not cancel the fine, as if most people who can't afford a mask likely won't be able to afford a $1,000 fine?
So the community has been fantastic so far with all of our orders, from the stay home, work safe to the bars and restaurants, to this order, we'll see, but I trust they'll be good in terms of complying with these requirements and there not being the need for enforcement. But that doesn't mean that enforcement shouldn't be present. And so that's why I want to stress, you know, some folks are trying to make a political statement out of saying we're going to prioritize education. That's what I've been asking for all along, not just with this order, to be clear, with all orders. Folks can go back and check every time we've issued an order. I've been incredibly clear. This is not a police state. We need to prioritize education. I believe and I hope that the enforcement will not be necessary. This is about life and death. If you don't wear a mask, it's not about you. It's about the people around you. You might get somebody sick. You might kill your grandma. You might lead to the death of somebody who is immunocompromised, who lives with the person you were hanging out with without a mask. So this is something serious, and that's why we need to make clear that it is not optional. And so, yeah, we would ask, please. We tried that 2-3 weeks ago. You know, the mayor and I went out. We said, look, we're wearing masks, just as the federal government recommended. Please wear them. And most people did, but not enough. And so for the sake of our community's safety, for the sake of saving lives, we needed to make this mandatory. The fact that there is a fine doesn't mean that folks are going out there proactively and issuing fines. That's not been the case, not with this order, not with any of the other orders. That is not new. And so folks saying, I'm not issuing fine, great, thank you. That's what I asked you to do. But that doesn't mean that we shouldn't have that provision there. And so we do ask folks that they wear the mask because this is not a matter of convenience, it's a matter of life or death for people.
This question's from ABC 13. It says the governor is expected to talk about opening up some businesses and give a timeline. It could be as early May. What are Dr. Shaw's feelings on that? Is it too soon, Dr. Shaw?
So we've been working very closely with the governor, and I look forward to seeing what he'll announce later today. Did you have something to add?
Yeah. Thank you for that. You know, I think what we want to just continue to stress, and the judge just said this, is that we are working with our federal, state, and local partners throughout this entire pandemic. We cannot do this alone. We have to work together. And I think the key message for all of us is that we have made a tremendous amount of efforts in this community, sacrifices that our entirety of the community has made, and we want to make sure that we don't go back on anything, and that we don't undo that fantastic work that has been done. So far, we are optimistic and we're hopeful, and we're continuing to monitor that what's happened in our healthcare system continues to be what remains in our healthcare system, that it's manageable, that they're able to handle the number of people that come through. The judge has said this absolutely the right way, which is we're continuing to work with our state partners. And I know that our governor and our state health officials are very much also concerned about what's happening in Harris County. And certainly they're going to do everything they can to also work with us. From our standpoint, reopening is all about, from a public health standpoint, reopening is all about being methodical, reason-based, and make sure that we do not undo any of the work that we have done, because that is absolutely critical to saving our community, not just now, but a couple, 2 or 3 weeks from now, when obviously people are now coming together.
This is from KHOU. There's been a lot of pushback on social media and elsewhere about the face covering requirement. What would you say to people who do not plan to abide by the rule?
Yeah, I mean, there's a small group of people trying to play politics and make a statement, I'm not going to wear a mask. This is not about you. It's not. It's not about the person wearing a mask. It's about everybody else. It's about you maybe at the grocery store next to somebody who's immunocompromised. It's about you may lead to the death of somebody because you've given the virus to them, or you've given the virus to a person who may then infect somebody else. And so this is not the time for political acrobatics. This is the time for us to each do our part. This is about life or death. And I just want to remind folks, you know, I didn't pull this out of nowhere. This is out of the CDC. It's out of the fact that if you're standing next to somebody and you have the virus, you may not know you have it, and you're giving it to somebody else. And so you have a right not to wear one when you're not going to lead to somebody's death by not wearing one. But right now, if we want the economy to reopen, if we want to move forward, we've got to stop the virus in its tracks. And so if you want to make a political statement and not wear a mask, stay home for the sake of everybody else. Because if you're sick, you can make a political statement, but it's not your right to be getting everybody else sick just because you want to get some attention.
This question's from the Chronicle. Why did the county not fine Federal American Grill restaurant who opened its doors on Friday? What is to stop other businesses from opening their doors too?
Look, the community, as I mentioned before, has been fantastic. We've flattened the curve. It's not peaked, but it's not kept rising. And we've saved already over 4,500 lives, according to Rice University. And that's because the vast majority of the people, 99.9% of people, are doing their part. And so I'm not going to say anything more about that restaurant. I'm not going to give them any more time for a political stunt. And I believe that their 15 minutes in the limelight are over.
This question from Telemundo, in Spanish, please. Sheriff Gonzalez tweeted this morning saying, "We are not planning to give tickets or anything. Then should we forget about the $1,000 fine?"
Sí, en cuanto a la multa, como hemos dicho ya varias veces, el 99% de las personas, de los negocios, han puesto de su parte en todas nuestras órdenes, tanto la orden de quedes en casa, como la orden de los bares y los restaurantes, como ahora espero esta, no ha sido necesario dar multas. Entonces, hay ciertas personas que están intentando crear algo político, diciendo no habrán multas. Nunca hemos dicho que deben haber multas. Siempre hemos dicho, o sea, deben existir, pero esperamos no utilizarlas. Entonces, le agradezco a los miembros de la policía que, como les he pedido yo, con todas las órdenes, no solo esta, sino con todas las órdenes, pueden ver en mis comentarios, en cada una he pedido a la policía, por favor, priorizar la educación, porque este no es un estado policía, es una comunidad libre, y yo espero y realmente creo que todos van a poner de su parte. Y eso es lo que hemos hecho hasta ahora. Entonces, realmente no creo que sea nada distinto con esta orden de mascarillas. Yo pienso que sí la gente va a obedecer. Es importante igual tener ahí esa multa, porque esto es de vida o muerte. Si tú no utilizas la mascarilla, no es para ti, es para los demás. Puedes contagiar a una persona que pueda morir del virus. Puedes llevar a la muerte de un abuelo, una abuela, una persona joven que tenga alguna enfermedad. Entonces, alguna persona que no quiere utilizar la mascarilla, bueno, quédese en casa, pero no contagie a la demás gente. Y la policía se les agradece que hagan lo que les he pedido con todas las órdenes, que es priorizar la educación, pero igual hay que tener una multa ahí presente por si fuera necesario utilizarla, porque esto se trata de vidas y de muertes. Es algo que la ciencia dice, que el virus se contagia al estar cerca, y si nos cubrimos la boca y la nariz, eso ayuda a minimizar el contagio, lo cual es muy necesario, especialmente si queremos reabrir la economía.
This question's for Dr. Shaw. Earlier you mentioned the importance of testing and that anyone can get tested. So to be clear, if someone is not experiencing some symptoms that are commonly known for COVID-19 and they are fearful that they may have COVID-19 as a precaution, can they go to one of the testing sites, say like in Baytown or Katy, to be tested?
Yeah, so thanks for asking about the nuance here. So we have said throughout that we're prioritizing those with symptoms. That is what we've said throughout, that we're prioritizing those with symptoms. However, now that we have additional capacity to test outside of those with symptoms, we're able to also handle those without symptoms. So now, you know, if you have an individual who, and we know of scenarios like this, an individual who has completely for a few weeks has not been in touch with anybody, has just been, really in their apartment or their home has not been in touch with anybody, and they do not have any symptoms, they have not been in contact physically with anybody, and they feel like, look, I do not have COVID-19, and there's no reason they're not in any of those risk categories that we talk about, elderly or with underlying medical conditions. Those individuals might say, you know what, I'm not sure I need to get tested. I'm not going to force that individual to get tested. I'm actually going to say, look, you continue to watch your symptoms and do all the things that we're asking: social distancing, hand hygiene, personal hygiene, sanitation, as well as wearing, remember, it's not just a mask, we're talking about facial coverings. Those are the kinds of things that we're saying. But if you are an individual that does not have symptoms, but you have been out in the public, like for example, I don't have symptoms, but I'm in the public a lot. And my wife says this all the time: you are out there, you're out in public a lot. How do you know that you don't have, symptoms now, or you don't need to be tested? And the answer is that I don't. And so if you're in a category like that, we're saying, look, we're still prioritizing those with symptoms, but we're also saying that, look, if you feel that you've been out and about and you've been potentially exposed, then we are able to handle you for testing. We do not want that to be the barrier. It's free. There's no cost to it. It's just a matter of driving there. And that's why the judge is absolutely right that the expansion outside of these two mobile sites that we have right now, in addition to the Baytown Katy sites, is about getting into the community, working with our precinct commissioners, getting into the community and testing where people are, because we do know transportation is a potential barrier. So again, readyharris.org, 832-927-7575. Please get tested.
Yeah, and I do want to add on the test. So right now it's relying on folks who think they may be sick to come, and that's why we're saying, please help us out, because you're coming and getting tested helps us. It helps everybody. Later on, once we move to the phase where we're able to contain these resources, these tests that we have, we truly each test even more precious, because for every person who comes back positive, we're going to have to trace their contacts, and that's going to be quite a few people. And so for each person, we're going to need many tests that we're going to have to make sure those people get tested. So this is necessary now, but it's also a key step for the future. And I do want to remind folks, I don't want folks concerned. You mentioned earlier, if people need to buy a mask and they can't afford one. Guys, you don't need to buy one. I'm wearing this one because I'm here in the press, but I've tied a t-shirt around my, like literally just grab one, go like this. The point is that if you cough, if you sneeze, if you talk, that there's a barrier that is not allowing that virus to get out to whoever you're interacting with. That's the point. You don't need to buy anything. You could just use what you have at home. And so again, it just highlights some folks are trying to score political points on this, and it's just not the time. It's really not. And once this is over, I'll be happy to debate with anybody about the decisions that were made. That's the reason we have elected leaders. And so in 2 years from now, when I'm up for re-election, I will be happy to debate what decisions were made and why, anytime, anywhere, with anybody. But right now, let's use science. And the science says if we cover our nose and mouth, it doesn't spread. And everybody knows they have a t-shirt they can tie around their head, so there shouldn't be any conversation, I can't afford this. There should be conversation, well, I'm not going to enforce this. You're not asked to. I'm saying don't, leave the fines as a last resort. There have been fines in every other order. Other communities have fines in their orders. And this is not the time to play politics. It's the time to save lives.
From KHRU, so will Harris County be on board if the governor, who had mentioned on a radio station that he's looking at the first few days in May to start reopening the process of stores, movie theaters, restaurants, et cetera. Is Harris County on board if the governor says reopen in early May?
Look, I got to see what the governor announces. That's the thing, is we have to see what he announces. I've been in close contact with him. We're grateful for the partnership so far. Every day, thanks to people's sacrifice, we do better and better and better. And so there is a chance that we'll be prepared to step back then. It depends, what kind of a step back does he announce? Then we'll see, is our community ready for that? And of course, if between now and then we see a spike, we see a peak, then, we just got to go with the numbers. But so far, that curve is flattened. We're headed in the right direction, and I'm eager to hear his announcement, grateful for his support, and just want to remind, I know some folks are waiting for me to say something negative, but I have nothing negative to say. We are great partners. We need to work together across political parties, and that's why it's so disappointing for folks to feed the fire about, folks playing politics with things like the mask order.
Judge, can I
Yeah.
make one comment? I just wanted to make one comment that as we're hearing this reopening phrase of our community, and all of us, and Judge has said the same thing over and over again, we want to get our community back to being able to do all the activities that it has been doing. But we also have to recognize that we want to do it safely. And that's why what we're doing here, that all these practices from a health standpoint, these are to get our community in practice so that when we do come back together, we're not going to forget that we have to wash our hands. We're not going to forget that we're socially distancing 6 feet apart or we're wearing the facial coverings. These are all to be complementary and also to allow all of us to be good practice so that when we do come back as a community, that reopening isn't one of those where all of a sudden we mix together and now we see an explosion of cases. That's not what any of us want. So these are practices that we're trying to put in place in advance of knowing that people are going to be coming together when we reopen. Thank you, Judge.
From KHOU, tomorrow's Commissioners Court agenda has an item to expand voting by mail due to COVID-19. How feasible is that, and are you in favor?
Yeah, so, we want to protect people from the virus. And of course, our democracy is just a treasure of this country. So we need to make sure that as we deal with the virus, that we also have a safe way for people to express their vote come election time. And so we are exploring how the county could feasibly allow vote by mail for folks who are afraid that they, and rightly so, that they would contract the virus by being in close contact and particularly touching everything that folks are touching when they go and vote. So we're working through exactly what it would take. Of course, there are logistical hurdles. If, to the extent that we can overcome those logistical hurdles, I am absolutely in favor of ensuring that folks don't have to choose between their health and their right to vote. Good. Thank you all so much. Appreciate it. Thank you. Thank you.